Okay, so basically we only have few more lectures. This today and then 2 more classes with me. Because I had another lecture I will cover 2 in 1. And then 1 more. And then Prof. Jaila will cover another 2 or 3 lecture. I think we're almost done. And then our final will be on July 14th. So maybe I guess we're a bit ahead of time. So you have a lot of like empty slots. Never mind. You can work on your presentation, and then we can have some classes for revision. Because I will give you some cases and stuff for you to practice on avian diagnosis. And then test 2 should come sometime soon. I believe you have a lot of test 2 this week. So maybe we can do our test 2 next week. Okay. Okay. Before that, do you have any question on anything at all? Assignments or whatever on previous classes on how to study or whatnot? If you don't have, so let's proceed with today's class. So today's class will cover 2 lectures as well, lectures 18 and 19, because there's not that many. I think it's quite short, but a lot of important diseases here. So we'll cover disease of sudden death. Let's get started. Share screen. Okay, hope you can see this. Second. Okay, today we are going to cover some diseases that goes under sudden death. Why is it sudden death? Because most of the time, these all diseases, they don't show any like signs per se. They just die. They just die, and then only you know you have problem at the farm without any clinical signs, because the classification, they don't show like respiratory signs so much, or like diarrhea or something over a period of time, and then you know the disease is like they just die. Then after they die, then only you know. I will cover some of the disease lah. I think some of these disease I didn't cover because more or less the same, or it's not that important, or you may not encounter it, but you may Google it lah. Because some of these, some of other disease that goes under the same classification. So the first one is a fatty liver hemorrhagic syndrome. Is usually affecting long-lived birds, especially the cage layers. Okay, and it's affecting the chickens worldwide. Has been reported since 1956, if I'm not mistaken. And most common in high-producing flock during hot weathers. The etiology, it was said that is due to excessive consumption of high energy diets combined with restricted activity, which results in excessive fat deposition in the liver. Contributing factors may include genetic component, and then some of it, they are saying that is maybe related with aflatoxin as well. There's some lot of things that may contribute to it lah. And then excessive fats, the a little bit of the pathogenesis is due to excessive fats disrupt the architecture of the liver and weaken the reticular framework and blood vessel in the liver. And then your liver will look like fatty, which is like they look yellowish, and they'll be like, because of the weakened blood vessel, it leads to hemorrhages. And then the syndrome may be caused by deficiency of lipotrophic agent, which are necessary for mobilization of fats from the liver. What are lipotrophic agent? Like some is like vitamin E, vitamin B12, biotin, like some of those lah. And then fatty liver hemorrhagic syndrome and cage layer fatty are often diagnosed simultaneously, because usually fatty liver hemorrhagic syndrome happen during the peak production, and then cage layer fatty also happen during the peak production of layers. The clinical signs usually seen in hens that are overweight, okay, because they eat so much. And during this period, there'll be some drop of egg production, usually from 78 or 98, 78 to 85% drops to 50% around that range. There'll sudden increase in the mortality, but in full production, looks like pale comb and wattle. Mortality can go as high up to 5%. So the mortality usually you don't see so much mortality. Is more of uh, egg production issue. But 5% mortality in layers is actually a big loss because layers are long-lived birds. You have kept them for 20 weeks, 30 weeks, 40 weeks, okay? And then it costs a lot to reach that age. All the feeds, all the consumption, vaccines and everything. So even though 5% mortality is actually a bit losses to the company. Postmortem lesions, what you'll see is one of the common typical finding is blood clots in the abdomen and in the liver. So arising from the liver and often partially enveloping the liver. Sometimes it's like it covers the whole liver or partial part of the liver. And then hematomas may be present, may be recent, dark red or old in if it's much older or if it's been a while, it looks like greenish to brownish in color. The liver usually appear enlarged, pale, and friable. There'll be large amount of fats in the abdominal cavity and around the viscera because usually you'll see this in overweight birds. Blood chemistry, if you do, usually we don't really do a lot of blood chemistry in chickens, but if you do, you'll see increased AST and other liver enzyme. If I'm not mistaken, you're taking CP this semester, right? Then you should know what are AST and other liver enzymes. Please revise your CP notes. The lipid contents of liver generally exceeds 40% dry weight and may reach up to 70%. The lesions, this is how the lesion look like. Usually what you see in overweight birds, all the fat contents covering the abdominal cavity. This is quite fat deposition in abdominal cavity um of layers is quite common. Okay, it's quite common. It's just that in these cases you may see like they'll see blood clots in this area. Okay, and then the liver turn yellowish. It's like this one, and then this is what where the hematoma is, a partial hematoma of the liver, something like this or something like this. So when you see these kind of things, what you have to do is you may want to send for usually the lesion itself is quite characteristic, and then you may make a tentative diagnosis just based on the gross lesion. Some confirmation of it, you may want to do histology. If you do histology, you may see like lipid accumulations in the liver and hemorrhages in the liver just to confirm it. It's just like basically that's about it lah. And then for treatment, like I said, because it's usually related with excessive high energy intake, so you may want to reduce the diet. Okay, you want to reduce the diet and energy intake, and then you may want to introduce lipotrophic agent, like I said, vitamin E, vitamin B12, and others, and to reduce that. But however, based on some research, is saying that different lipotrophic agents providing a variety of results. Some are effective, some are not really effective. So basically, you may want to just reduce the obesity of these laying birds. Okay, so that's all. That's about it. About fatty liver hemorrhagic syndromes. Okay, next one is leukocytosis. Okay, this one is quite common in Malaysia. I've seen it quite a number of times, quite a lot of times actually. One of the reason is because of our tropical country. Okay, this leukocytosis requires this is caused by leukocytosis cholerae, Smithy in Turkey, Simandi in ducks, and Niave in guinea fowl. Okay, this is what the one causing in chickens usually cholerae and then Andrewsy. The life cycles requires two hosts. The sporogony stage is in insects, like in mosquito or simulate flies. And the schizogony and the gametogony is in tissue or blood cells, which requires them to replicate in tissue, which is in the chickens or in the host, other hosts. turkeys, ducks, or any others. So the reason why this is quite common and endemic in Malaysia, especially in northern region. Okay, northern region. This always been reported in Kedah area. Okay, Kedah is one of the biggest producer of poultry, and at the same time, they also one of the big producer for rice, and then they have a lot of paddy field, and then all these paddy fields they have a lot of area which is wet area swamp, and then is the breeding area for mosquitoes. Okay, the breeding area mosquito. So that's why it's a bit difficult to control this in that area. When I talked to a lot of vets that were working in northern area, Kedah area, they keep saying that this is like common thing. They'll see it like almost every week in broilers. Okay, in broilers, especially if the farm is literally located nearby a paddy field or something. Okay. The intermediate host is simulate flies, culicoides midges, and mosquitoes. The epizootiology are the carriers are wild or domestic chickens. The clinical signs is sudden onset of depression, anorexia, thirst, loss of equilibrium, weakness, and pale. You may notice some rapid labored breathing, and often the course is quite short, and then the affected bird die or improve within few days. Mortality usually high if you didn't control it early. Latest cases I've seen, even in UPM, we have our research area here in UPM at near the stadium there. Those near the stadium there, we have a research area for chickens. We breed some chickens over there. They have reported quite a number of times of leukocytosis as well, because back then they have a small lake area, swamp area with a lot of mosquitoes in that area. So this is what happened. And then one of the thing that we always notice in these chickens affected by leukocytosis is sometimes there's blood oozing out from the nose or oral cavity. Okay, then they just die with pale and weak like that. Postmortem findings, what you'll see is if you do postmortem in this particular birds affected with leukocytosis, you'll see signs of splenomegaly, hepatomegaly, and anemia. And one of the characteristic is hemorrhages on the breast muscle, leg muscle, and mucosa. They are pinpoint hemorrhages. And then one of the, I call it more like, I would say quite pathognomonic is hemorrhagic kidney. Okay, it's quite very typical signs is hemorrhagic kidney become pale and swollen. This is how they look like. Okay, the muscle region. This is a case that I said we got from the stadium there. Okay, this is what they look like. The pinpoint hemorrhages all over the muscle, even the under the skin. Okay, subcutaneous layer, subcutaneous tissue, and then on the fats. Okay, even on the pancreas and basically everywhere. On even on the abdominal fats as well. So you can see it's like the petechial hemorrhages. And then they'll say hemorrhagic kidney. This one is not so severe. There's some hemorrhages here. It's like swollen and congested. But this is how they look like. It's like a clump of blood. Okay, blood clots on the kidney. So when you notice this hemorrhages on the muscle and a lot of abdominal cavities, and then you open up and then you look at the kidney and the hemorrhages on the kidney. So it's quite confirm is leukocytosis case. Okay. And then, but additionally, you can still take samples. You can do a blood smear. And then you stain with right stain or gemstar stain to look at the blood smear. If you see the leukocytosis, you can also do squash smear of the liver or the kidney, looking for the schizones. And then histologically, you may want to look on take the liver, the brain, the kidney, or mucous membranes, the one that with the petechial hemorrhages. You may be able to see schizones and megaloschizones. So this is how they look under the microscope. You know the blood of chickens are nucleated blood, and then this is how they look like. Okay, this is how they look like. But it's not as easy to look as well, because there are some cases you do a blood smear, you didn't see it unless it's really, really severe. So this is how they look like again. This is a tissue, some tissues, the schizons and megaloschizons. Okay, if you do histology of the spleen, this is spleen area, and then this is the megaloschizons in the liver, the kidney, and bursa avaricious. It's basically everywhere. Okay, so despite of having similar postmortem lesion, it is important to differentiate leukocytosis and infectious bursal disease. Because infectious bursal, there are three diseases that can cause hemorrhages of the muscle. One of it is leukocytosis. Second is infectious bursal disease. Another one is chicken infectious anemia. I think I will cover chicken infectious anemia in the next class. Okay, so they look like this. The difference is the leukocytosis usually is pinpoint in nature like that, and infectious bursal disease usually they look like they follow the musculature line, the muscle streaks. Okay, sometimes they just a splash of blood in the muscle. However, in leukocytosis usually it pinpoint polka dots. It's like polka dots in appearance. Okay, same as chicken infectious anemia. Chicken infectious anemia also have similar lesions with infectious bursal disease, which is like this. How to control it? So the best way to control it, because leukocytosis requires two hosts to complete the cycle. You just need to eliminate one of the hosts. Okay, if you eliminate the host, you stop the cycle or their life cycle. So basically, you have to eliminate the vectors. If possible, prevent building farms or around marshy areas. Okay, avoid marshy areas for your farms. If you cannot avoid it, find a way to kill the mosquitoes. Do a fogging or sometime once a while, or you can put nets or anything to prevent vectors entering into your farm. Okay. And then for treatment, there's few treatments is available. However, they will say that they are quite a limited success. But in our case, we have used sulfadimetoxin and pyrimethamine drugs, and it works quite well. I mean, in reducing the but it have to be done early when you start noticing some of the birds showing signs start dying, and then you start the treatment immediately, and also clopidol. Okay, so those are about leukocytosis. Next one is sudden death syndrome. Okay, sudden death syndrome is something that you will probably see if you are technical vets for broiler farm, broiler farms. Broiler farms. If you are in charge of a lot of broiler farms, you probably will see this quite a number of times. Okay, apparently healthy, fast-growing broiler chickens die suddenly after a short terminal wing beating convulsion. Sometimes, if you enter a farm or a big farm, each houses probably contains like 20,000 or 30,000 farm, 10, 20, 30,000 chickens. Okay, as you walk inside the farm, looking at all the chickens, whether they look okay, everything. Once a while, you will see like suddenly one of them like they just die. They're like flapping and then die in front of you. Okay, but that bird's found lying on their back. Usually they flip to their back and then die. And it occurs from 1 to 8 weeks of age, and usually males, because males the size is bigger. It's also known as acute death syndrome, heart attack, flip over syndrome, death in good body condition, or lung edema. Is sometimes it's not something that of big of a concern. It's something that you will see occasionally. If you see this, it's not a sign that you have a disease at the farm, you have infection at the farm. It's just something that it happened. Okay, it happened. You will say that dah sampai ajal. Okay, okay, they just die. Okay, because there's few explanation for it. The exact etiology is unknown, but they say it's probably heart attack, ventricular defibrillation, or electrolyte imbalance. They just die, okay, because of the heavy weight and stuff. Clinical signs, there is no clinical signs. They just die. The moment is it, they drop dead. Sudden death after convulsion and wing flaps. So they just die. And usually found with their, like I mentioned earlier, on their back. Usually they found on their back. Okay? They look perfectly healthy. A good body condition, fat birds, they look healthy, don't have any signs. If you do postmortem, you will not see any lesions at all. They look just okay. 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 The next one is pulmonary hypertension syndrome. This is also usually happen in broiler, especially at the end stage when they are already like really big. 4 weeks, around 4 weeks or more, 4 weeks and above 4 weeks. And then what you'll see is ascites secondary to pulmonary hypertension syndrome. It's associated with rapid growth and high metabolic rates of these birds because broilers, I think I've mentioned in the previous class, broilers have been bred, okay, broilers have been bred so that they grow so fast, very fast. Okay, you probably have heard this myth before. There's been talking about this online saying that all these chicken are fat because they are injected with hormones and whatnot. Those are myths lah. Nobody inject chicken with hormone. Hormone is not cheap. Okay, you have to go to Thailand to inject hormone. Okay, so hormone is not cheap. Why you waste on chickens? What happened is what really happened is they get fat, they get big so fast because of this selection, genetic selection. Okay, you take the highest rapid growth and then you breed it with another rapid growth chicken and then you get a very big chickens. And on top of that is because of good management. In comparison with 1900 back then, the chickens are kept free range and everything. Now we had all the chickens live in indoors, closed house system, in air condition, very hygienic and everything. So they basically eat and sleep. So that's why they get fat very fast. So it occurs worldwide in rapid growing broiler. So it's been reported everywhere. There are four pathophysiological mechanisms that have been recognized to cause this. One is increased hydrostatic vascular pressure. Second is decreased oncotic pressure. Third is increased capillary permeability. And fourth is impaired lymphatic drainage, which leads to the formation of the ascites and increase the pressure, pulmonary hypertension. So this is, if you want to read the pathogenesis lah. Rapid growth leads to elevated metabolic rates. When they grow so fast, they got so fat, and then when their body is very big, they requires them to breathe faster. The heart have to pump more to supply or to all the muscles of their body, and then the oxygen demand become higher. They increase the workload of the heart and leads to the pulmonary hypertension due to insufficient capillary capacity, and then leads to when the pump so hard is it leads to right ventricular hypertrophy. Okay, if you have you pump right, the heart muscle lose the elasticity. Okay, become hypertrophic to compensate with the hypertension and leads to the dilatation, and then dilatation leads to the right ventricular failure and then leads to the passive congestion and leads to ascites. I think if you cover if you have taken pathology class, right? You have taken pathology class. I think if you revise back on your cardiovascular pathology, you will understand more on the pathogenesis of right ventricular heart failure. The clinical signs I will see in this case usually happen like I said at the end period, like 5th or 6th week of growing period, at the harvesting stage when they are really big. Okay, birds are smaller than normal than the bigger one, depressed with ruffled feathers. Usually they appear with abdominal distension and reluctant to move with respiratory distress and cyanosis. How they look like. They look cyanotic, darken, bluish, and with enlarged abdomen because of the ascites. And if you do postmortem, you'll see hypertrophy and dilatation of right ventricle with or without straw-colored ascitic fluid in the peritoneal cavity, generalized passive congestion, hydropericardium, which means like in the heart have a sac, right? And then the sac is filled with fluids. Protein clots in ascitic fluids and fibrotic liver may present in chronic pulmonary hypertension syndromes. Microscopically, you just see generalized passive congestion. And then see if you do postmortem, you do a cut surface of the heart, and then you'll see ventricular hypertrophy and dilatation. A normal heart, okay, you shouldn't see this big space. It should be like very narrow here. Okay? Very narrow. This is like hypertrophic, dilated already. Okay? And then another thing you'll see is straw-colored ascitic fluid. See, this is straw-colored ascitic fluid. This is a liver. Even the heart here, see how big the heart is? Relative to the liver, it's like as big as the liver. And you know like the heart is not as big as that, supposedly. Okay, see how big is it? And then you see the ascites. And then the ascites sometimes in this case is already the plot is full with protein and become clots. And then again, passive congestion and large heart and ascites and large heart congestion and ascites. And then the liver may appear fibrotic as in some cases. So diagnosis, microscopic lesions are usually diagnostic. You see big birds, end stage, open, you see ascites. Okay, and then you see big heart. So it's very suggestive. If mortality abnormally high, you may want to check for causes of decreasing oxygen availability. Okay, usually mortality is not that high. It's something that you will see once a while, or the rate is very low. But if the rate is like very higher than normal, you may want to check if the chances that decreased oxygen availability, for example, the ventilation is not so good, requires the birds to hyperventilate. Okay. Other diagnosis is also is like sodium toxicity, salt toxicity, dioxin toxicity, or phenolic compounds. Control, you may want to reduce early growth rate. Okay, you don't want them to get fat so fast at the early stage. Okay, so that all the development is normal. At the end, you pump it. Okay, that's it. That's about it about pulmonary hypertension syndrome. And the next one that is quite common. It's not that common back then. I think it's become very common recently in the past few years. Okay, I think I have it reached Malaysia for I don't know from where or something, and then it become quite common since I returned from USA about 4 years ago. When I got back 4 years ago, a lot of farms reported this disease, and then the disease is quite I would say sporadic in nature. Sometimes the report is getting high, and then sometimes it's upside down. Nobody reported about it. It's just once a while, and then suddenly there's an outbreak everywhere. A lot of farms reporting it. So yeah, okay, that's about it about the situation. Inclusion body hepatitis is a disease of young chickens characterized by sudden onset, increased mortality, and hepatitis accompanied with intranuclear inclusion bodies. That's why it's called inclusion body hepatitis. It's caused by adenovirus. The transmission is through horizontal fecal oral route and fomites, and there is also vertical transmission. So this disease can transmit horizontally and vertically, and is often associated with immunosuppressive diseases, which is infectious bursar disease and chicken infectious anemia. However, recent findings have shown that this is not always true. They say that inclusion body hepatitis can happen even though the chicken are not immunosuppressed. Clinical signs, there's marked increase in mortality, usually less than 10%. Peak after 3 to 4 days, but stops at day 5. Occasionally continues for 2 to 3 weeks. What you'll see is paler comb, wattles, and facial skin. The chicken will appear depressed and listless. In my experience, inclusion body hepatitis, they are quite they're like self-limiting in nature. When it happens, suddenly you have increased mortality. A lot of chickens dying. And then those that survive, they just survive. It's just what happened is the uniformity may be affected, the growth rate may be affected. But when it happened, there are high number of mortality, and then it stops. And then they just recover. The rest will recover. What happened in postmortem? Okay, when you do postmortem, you look at the skin, the chicken appear pale and icteric. Petechial and hecamotic hemorrhages on the leg, breast, and under serous membranes. The liver appears swollen, yellow mottling hemorrhages under the capsule. The kidneys usually appear swollen, pale, and mottled. And bursa, sometimes you see the bursa are atrophied. They, like I said, is usually associated with infectious bursal disease. Multifocal to locally extensive degeneration. If you do histology, you'll see degeneration and necrosis of the hepatocytes. And then what you try to look for is large basophilic intranuclear adenoviral inclusion. This is the pathognomonic lesions. If you see these intranuclear inclusion bodies, and you can confirm this is inclusion body hepatitis. The kidney appears membranous and membranoproliferative glomularitis, and less frequently cortical tubular degeneration and inflammatory cells. Bursa sometimes reduce in size, reduce follicular size with mild to moderate follicular lymphoid depletion. The bursa become atrophied. So this is how they look like. The chickens appear icteric, yellowish, jaundice, and you'll see some hemorrhages underneath the skin. And then the liver appear enlarged with some hemorrhages. The kidney appear enlarged also, hence the mottled, like all the dot, and then reddish. And then these how they look like. Okay, the liver, there's some ecchymotic hemorrhages on the liver, and then the liver usually is yellowish. Okay, this is also again the kidney enlarged. Okay, that's how they look like. And if you do postmortem histology, or you expect to see in the liver, you can see the parenchyma of the liver. Some of this liver still have the normal parenchyma, and you notice here all this one is replaced with fibrous tissue, and then it lose the liver structure. I hope you know the anatomy of normal liver, right? If you know the normal one, then you know this is not normal. You see they lose the structure of the liver, all this, and then infiltration of the inflammatory cells. And then under higher magnification, you will see intranuclear inclusion bodies. All this. Okay, intranuclear inclusion bodies. For diagnosis, you based on the history, sudden increase of mortality, and the gross lesion, and you see hemorrhages of liver and stuff. And then you can take samples, histology, you look for intranuclear inclusion in the liver. And then in some cases, you may want to do virus isolation. There is no treatment for inclusion body hepatitis because it's a virus problem. However, in what I advise them, one of the way is when you notice increase in mortality and in chickens, and then you look at the signs, a lot of liver problem, what we did is we give liver protectants. They it's actually a supplement, liver supplements, sort of liver supplements. It will reduce the severity and the length of the problem. So usually the duration lasted about 1 week. If you give liver protectant early or give all the supplements early, and then the duration is less and the mortality usually lesser than if you didn't give anything. Okay. So that's it about inclusion body hepatitis. Okay, it's quite common in Malaysia. It's very common in Malaysia. In fact, Prof Hair, I think you know Prof Hair. Prof Hair have developed a new vaccine as well against inclusion body hepatitis. It's being used in Malaysia. It's being used in Malaysia. Okay, next one is marble spleen disease. Usually happen in peasants. Honestly, I've never seen this myself, but I have to teach you. The etiology is also adenovirus. They spread through laterally fecal oral route. The host usually happen is older peasant, 3 to 8 months old peasant. Clinical signs, they just die. Mortality less than 15%. What happened is we do postmortem. We'll say enlarged spleen, mottle, and marbling of the spleen. This is the spleen. Okay, you can see spleen usually supposed to have a small spleen and then like red, maroon in color. Okay, and then this one you see some other marbling and mottling. There's like white spots there. And then you'll see also edema and congestion of the lung. Histologically, you'll see the spleen, reticulous endothelium, cell hyperplasia, and the lung, you'll see signs of necrosis and intranuclear inclusion, congestion, and edema. Most likely, I'm not sure because we don't have a lot of pigeon here in Malaysia. I don't think we have a lot of pigeon breeders. But yeah, most likely you will not see this disease, but just keep in mind it can happen. So diagnosis, you can do AGPT or ELISA. And control, there is vaccines against it. There is vaccines against it. There is vaccines against it. I forgot about this one. This one also control, there's vaccines against it. And then, and of course, biosecurity lah. Okay, I think that's all for today. Do you have any question on any of the diseases? Avian monocytosis and fatty liver and kidney syndrome, I didn't cover it, but you may want to read about it. Okay, fatty liver and kidney syndrome is almost similar with fatty liver hemorrhagic syndrome. Okay, any question at all on anything at all? Right, let me check. Okay, nothing in the chat as well. Participants. Okay, if there's none, I think that's all for today. I just need to discuss with you when do you want to have your test 2. A few more lectures to cover. Okay? If not, maybe your class course rep can discuss with me. Glenn can discuss with me when do you want to do the test 2.
Sure, Doctor. I'll discuss with my classmates first, and then I'll tell you the date.
Okay, sure. Okay. If there is no question, I hope you understand. Okay, I hope you understand. If you are shy to ask during the class or anything, you can always message me or email me for further clarifications on anything at all. Okay, that's all for today. Thank you very much. Have a nice week ahead and stay safe, everyone, especially those who are staying in college. There's a lot of cases now. Please keep yourself at home if you don't want to go anywhere. Okay, please keep safe. Okay, see you guys. Bye-bye.
Thank you so much,
Doctor.
Doctor.
Thank you, Doctor.
Thank you.